Hello, my name is Dr. May, the Medical Director of the Richards Clinic. I welcome you to this week's episode of the Richards Clinic online educational series. Our topic for discussion this week is knee pain, knee arthritis. Actually, the knee joint is the joint mostly affected by osteoarthritis. It's so common that knee pain or knee osteoarthritis is synonymous with arthritis. So whenever I mention arthritis, people's mind will go to the knee. And why is the knee so much affected by arthritis? The knee is, number one, a weight-bearing joint. Number two, is a very complex joint made up of many structures. You have the patella, the tendons, ligaments, joint capsule, covering the joint, and any of these structures can be affected. Even when you go inside the joint, you more like open it up, you see the synovial membrane, synovial fluid, the bursa that surround the tendons, the articular cartilages. So the arthritis can start from any of these tissues and begins to spread. It doesn't start and remains in one place. It's like an acid that eats deep into the tissue. And women are mostly affected by this arthritis of the knee joint. For every 3 men, there are 5 women that have knee osteoarthritis. There are reasons for that, but that will be the topic for another day. But suffice it to know there is a common arthritis, and women are mostly affected by this arthritis more than men. And just as you might have learned from me, if you have been following a lecture, you don't treat any health condition without a proper diagnosis. So as long as the joints are concerned, you have to do imaging test. Like in this picture, this is an X-ray of a normal knee. You can see the bones have smooth edges. There's joint space separating the thigh bone and the lower leg bone. That space is the cartilage. In X-ray, cartilages appear as dark space. So this joint is fine. This joint can move freely, but there's a caveat. At early stages of arthritis, X-ray might tell you that all is well, because no problem has started occurring in the cartilages and the bones. But as long as it has started from the ligament, which does not show in the X-ray, the problem has started. So if it's not arrested at the level of the ligament, it goes deep and begins to affect the cartilages. And as you can see, one part of the cartilages has worn off so much that the bones have started approximating to each other. So this is an evidence of severe osteoarthritis, and this person will be having so much pain. So if he's not arrested here, the wear and tear continues, and the bones continue to approach each other further and further. Just as you can see here, the bones have flattened out because there's nothing cushioning again the weight when the person stands. So the weight transmits from bone to bone. So it's like when you're hitting a red hot iron. So it begins to flatten out like that, and that's what usually happens in arthritis. This condition you are seeing right here is even the worst. So the 2 knee joint spaces have almost completely worn out. So you have this person is having what is called the frozen joint. So the trick is to catch this things early and treat early. If not, it continues to degenerate further and further, and they can deform the joint. So some people's joint can be deformed into what we call bow leg. This person is not born with bow leg, but arthritis has caused the joint to bend. Some people can deform into knock knee, or what is called the K leg, especially if the person has suffered this for years. but these things can be arrested early enough when proper treatment is given. And what is the proper treatment? Not drugs, not painkiller, regenerative therapy. Regenerative therapy means that all those tissues that are damaged and worn out can be repaired, can be regenerated. And what does the repair is actually in the person's own blood, one of the cells in the blood called platelet. Just like this person is receiving PRP therapy. Wonderful thing about it is that the treatment is given directly at the joint involved. And let me explain a bit about this PRP. As I said, it's a treatment that introduces the platelet cell into the joint. And what is wonderful about platelet is because they contain growth factors. So this person has this knee arthritis. You can see everywhere is red. And what do? You harvest the person's blood. This is a demonstration, taking the person's blood. You now put the blood in a machine called centrifuge machine to spin it, so they can separate the components of the blood, the red blood cell, white blood cell, the plasma, which is the liquid part of the blood that contains the platelet. You don't need the red blood cell, which you discard. So the plasma that contains the platelet, which has been highly concentrated, is what you now collect in a syringe, you understand, and numb the area, to reduce the pain, and you introduce or inject into the affected joint. This treatment is so holistic that as far as you rightly inject it in the right place, it will heal every tissue that is degenerated in that joint. It's not selective. So it has a way of detecting where the damages are. These things is how they are empowered by nature, by God. They have what is called chemotactic properties. They move to the areas that are injured and begin to do the work of repair. So when the PRP is injected, within minutes, the platelet cells will release what's called growth factors. And just as I said, the growth factors will move to where the damage is. And when they get there, they attract other healing factors called macrophages, and they stimulate as well the release or activation of the stem cells. So all these factors will all work synergistically to rebuild the damaged ligament and cartilages. This is the hallmark of arthritis: damage of the ligaments and cartilages. And when they are repaired, the arthritis is actually repaired. So the person can live happy again. It's possible the person's arthritis can be healed. Gone are the days when we believe that arthritis has no treatment. Arthritis has treatment. It's possible that people can live pain-free, more especially when they start the treatment early enough in the condition. If you start it early enough, you actually stand up to 75% chance of permanent cure. So it's possible for one to live pain-free. It's possible for one to live healthy. It's possible for one to live happy. Thank you very much.